So I'm really happy that I'm able to be here tonight. I'm the Director of Community Education, Advocacy, and Outreach for the Madison House Autism Foundation. We started in 2009 because of a parent who had a 21-year-old at the time on the spectrum, on the autism spectrum, and realized, what happens when people go into adulthood, and so she wanted to start a national foundation that was going to look at adult issues for those on the autism spectrum, and then we realized that we need to break that autism bubble and really include the full array of intellectual and developmental disabilities. And so that's kind of the story of the beginning of the Madison House Autism Foundation. The Coalition for Community Choice is just one of the 3 housing programs that we have. The other program is the Autism Housing Network, which will be an online interactive portal where people will be able to have a one-stop shop of best practice residential opportunities, resources. It will be a place where we'll be able to continue dialogue and hopefully be a place where people who are looking to start their own programs or their own housing options or their own service providing agencies, that they'll be able to go there and not have to reinvent the wheel. It's currently in testing right now. Hopefully we might have something available by the end of the year. And then the third thing that I do is I do presentations like this, as well as small group consultations for parents or providers that are looking to start some sort of housing opportunity. So that's the Madison House Autism Foundation. Today, specifically, I'm going to be talking about state transition plans. Why does it matter? What the history is? What's in this final rule? What's the difference between the final rule and the guidance? The implementation timeline, highlights that I've seen as being the national coordinator for the Coalition for Community Choice. We lead, I help coordinate about 120 different organizations across the country that either provide housing or want to provide housing for individuals with intellectual disabilities in the future. So this really is an alliance of not just providers, but architects, businesses, family advocacy groups, self-advocacy groups. And I wanted to be able to share with you some of the trends that I saw in other states as well, to shed light on the New Jersey State Transition Plan. And then of course I'll share some examples of housing opportunities that are happening in other places that wouldn't be available here in New Jersey because of your policy. And then next steps, how can we change some of that? And so why does it matter? This is Madison. A wise woman once said, the more you take responsibility for your past and present, the more you're able to create the future you seek. This can never, ever happen again. This is a very, very dark history in the disability community. This is an institution that people were warehoused in, thousands and thousands of people. People who lived there, they were believed that they could not learn, they could not communicate. They were forcefully segregated. There was no choice. The people who lived there with disabilities had no control over their environment, had no opportunities, no say in what was going to happen in the day-to-day life. They were viewed by the greater community as having no value or contribution, and even as far as that they were dangerous to society. The culture that this came out of is still recent. This quote came from 1976 from an individual who lived in one of these settings. This is the past, that thank goodness there was protections that were put in place. There were many before 1990, but 1990 was kind of the Americans with Disabilities Act. That was the first real set of protections that prevented discrimination against the basis of someone having a disability. The next one that's really important is the Supreme Court Olmstead decision. This was incredibly important so that people could not be forced to be institutionalized, and that those who do choose to be in an institutional setting, once they've gotten to the point where they want to go back into some sort of community setting, that they have the ability to do so. They have the legal protection to be able to do so, and that they couldn't be forced to stay there. And then the Developmental Disabilities Assistance and Bill of Rights Act, that actually has progressed for decades during the time of that first push for deinstitutionalization. And this really does kind of highlight a lot more of the culture of what we exist in now. And that's that individuals with disabilities have the right to self-determined lives, to have person-centered plans, to be able to have a wide array of choices for housing and for service providers and employment opportunities. And the goal of a lot of these opportunities, these legislative movements, was really to give more choice, more control, and for them to be able to live more person-centered lives. So we're no longer putting people just in programs, but we're trying as much as possible to think, what does this individual need? How do they need to be supported in order to reach their life goals? But we have present challenges. There's a huge demand without nearly enough supply. Little is being done to increase the supply. Institutional attitudes and abuse still occur in community settings. There's a lack of quality, quantity, and accountability in the direct care workforce. And homes geographically located in community does not necessarily mean that one has relational community. There are very big barriers in support services, there's very big barriers in transportation, and there's not enough employment opportunities or day activities. So let's ask some questions. Let's look at the numbers, right? Where do individuals with intellectual and developmental disabilities live in New Jersey? 14,000 of them are living in some sort of supervised residential setting, whether that be a group home, adult foster care, supported living. 22,000 are living alone or with a roommate, but 74%, 100,000, are living at home with a family caregiver. Now, if we look at where those 14,000 live, if you look at this chart below, this kind of captures settings in terms of 3 blocks of time. 2003, which is 10 years ago, is in the blue. In the orange is 2008, 5 years after that, and then 2013. And this is the latest data from the state and states and developmental disabilities reports. And what I find really interesting is where you start looking at where these trends are going. So for those who are in an ICF, an intermediate care facility for those with developmental disabilities, those numbers have decreased, and that's pretty much a national trend. And other residential setting, which would be funded through an HCBS waivers, those have pretty much increased as well, but really not that much. I think what's very interesting is that supported living, which typically is what is wanting to become more popular for people to live in some place that they own and control, has really stayed the same in the last 5 years. There wasn't a big push, but what did change was those who are in nursing homes. And these are not nursing homes that are specialized to be able to provide the supports for individuals with developmental disabilities. These are just typical nursing homes. And in the past 5 years, 300 people have been put there. And so instead of them going into another setting, they ended up in a nursing home. And my question would be, well, why? And is that an institutional setting? So let's look in terms of, well, if there's people who are being moved from expensive settings into more community-based ones, well then we must have much more people being served, right? Well, that's not necessarily the case either. So this starts in 1996 to 2013. That's 17 years, almost 2 decades. And in those 17 years, you can see that really less than 3,000 additional individuals were funded to live outside of their family home. In order to meet the needs of those who are living with caregivers over the age of 60, New Jersey needs to not just double capacity, but they need to do it in half the time. Can individuals with intellectual and developmental disabilities afford housing? According to the Priced Out report in 2012, no. You need to be, just to have an efficiency in New Jersey, you need to have an income of 129% of your SSI. Only 92% have a paid job in the community, according to the National Core Indicators. But in order to have a living wage to even rent a 2-bedroom apartment, you have to make almost $25 an hour in New Jersey. So even with a paid job in the community, market rate rent is unaffordable. Affordable housing vouchers are very limited and absolutely cannot meet the demand. Is abuse happening? 63% of adults with IDD have been victims of abuse, according to a national survey. 34% sexually abused, 40% more than 10 times, and only 54% actually report it. The bottom line is that abuse is prevalent and it is pervasive. It happens in many ways, and it happens repeatedly to victims with all types of disabilities. And this is occurring in our community. These are not occurring in places where people are warehoused. This is occurring in our community. Reasons why people won't report: 58% believed nothing would happen. 38% were threatened or afraid. And 33% didn't know where to report. Direct care occupations are projected to be the second largest occupational group in the US by 2018. That's in just 3 years, exceeding the number of teachers, nurses, and law enforcement professionals. And the quality of staff that we have now, 45% of them live below the poverty line. They lack a career path. No wonder we have a 70% turnover rate. So one's experience of relational community. According to the Easter Seals Living with Autism study, parents were rating what they felt like their child and soon to be adult, how they are going to interact with the greater community. And these numbers are less than 20% believe that they would be valued, believe that they would have a spouse or life partner, regularly participate in activities, or have friends. And these are individuals who are living in their family homes. And I don't believe that the families who are part of this study are not doing their best to be able to provide opportunities for their loved one. But we need to ask people with disabilities. It is extremely important that the people who are receiving these HCBS waivers are being asked about their quality of life, are being asked about what they want, and being asked about what can change. So when the National Core Indicator Research Team decided to ask those with disabilities whether or not they feel lonely, about 40% of them said they did. And these are the settings where they felt the loneliness. Foster home settings, adult foster care. Sometimes that can be called shared living. Shared living is when both people who live in a home have equal authority or rights to their home. I don't believe shared living is when I get to invite someone with a disability in my home, and then when my mom needs to come home, or when I'm not able to provide the supports necessary, that person with a disability needs to move. That's not a shared home. That's me inviting people into my home. That's adult foster care. I think shared living needs to be used specifically when the person with a disability has control of that home. And maybe there's host family or host individuals that will come in and out, but they're the ones who get to control the stability of their home. I'll move off of that tangent. Next is someone who lives in their independent home or apartment. Still 43% they feel lonely. In a group home, 41%. In the family home, 40%. And those who feel least lonely are those who live with other people with developmental disabilities. Mother Teresa once said, "Loneliness and the feeling of being unwanted is the most terrible poverty." So what is this final rule, right? So the Affordable Care Act came into play. And because of that, CMS, the Center for Medicare and Medicaid Services, needed to change some of their regulations. And part of those regulations are the regulations that govern HCBS waivers, home and community-based waivers. And a waiver was established in 1980, and that was the need to waive institutional care in order to have access to support services in the community. So we've had these for almost 30 years now, right? Over 30 years. In 2008, they started the process, and this is the federal process. So in the Federal Registrar, they would set out a set of regulations, and really what they were trying to do was feel, from providers, from self-advocates, from families, what needed to be changed in the federal regulations, because these federal regulations were then going to go to the state so that the state can revise their state regulations. And so it went through 6 rounds of public comment at the federal level. And a lot of these conversations was really around the definition. How do we define home and community? Do we define it by how many people live in a house? Do we define it by where this house is? How do we define home and community? And in 2014, in January 2014, about a year and a half ago, they came out with the final regulations. And they decided that these final regulations were going to be outcome-oriented. So it wasn't going to be based on physical characteristics, it was going to be outcome-oriented. Within the final regulations, they also had a very strong emphasis in a person-centered planning process. So in the future, in order to access funds, HCBS funds, an individual is going to have a person-centered plan, and they're going to have that plan revised every year. It also emphasized integration in and full access to the communities as the same as those who are not receiving waiver services. So if I decide to live in an urban or suburban or rural setting, I need to have the same amount of access to my community as someone who is not receiving a waiver. So if that's in a rural setting, I need to be able to have the transportation, which doesn't need to be a public transportation line, it just needs to have access to transportation to the effect of the same as somebody without a disability who lives in that setting. And I feel as if this quote really encompasses a lot of what the final rule talks about in terms of settings. And this comes from the CMS HCBS fact sheet. They said, in this final rule, CMS is moving away from defining home and community settings by what they are not, and towards defining them by the nature and quality of individuals' experiences. The home and community-based settings provision in this final rule established a more outcome-oriented definition of home and community-based settings, rather than one based solely on a setting's location, geography, or physical characteristics. And this is so important because just like we saw in the slide about loneliness and about abuse, those things are happening in our community. It's not just in places where there's lots of people with disabilities congregated. And we need to have accountability systems that are listening to the individual in their own apartment, that are making sure that they're able to access their life goals and they have access to employment opportunities, just as someone who might be living in a setting that has 6 individuals living in a home, or a setting that might be a campus setting. We need to, the final rule really did try to encompass the fact that we need to focus on individuals' experiences when we're thinking about what creates that home and community setting. And so, what is in this final rule? Very, very specifically, I cut and pasted this from the CMS fact sheet, and it's also in the handout that was on this table. The setting must be integrated in and support full access of individuals receiving Medicaid HCBS waivers to the greater community, including opportunities to seek employment, work in competitive integrated settings, engage in community life, and control personal resources and receive services in the community to the same degree of access as individuals not receiving Medicaid HCBS. The setting is selected by the individual from among setting options, including non-disability specific settings and an option for a private unit in a residential setting. The setting options are identified and documented in a person-centered service plan and are based on the individual's needs, preferences, and for residential settings, resources available for room and board. There's 3 others. Ensures the individual's rights of privacy, dignity, and respect, and freedom from coercion and restraint. It optimizes but not regiment individual initiative, autonomy, and independence in making life choices, including but not limited to daily activities, physical environment, and with whom to interact. It facilitates choice regarding services and supports and who provides them. So this is the case for all HCBS settings. So if you live in your own apartment, this is the case. This is what's required by the federal final rule, the federal floor. Now, for settings that are provider-owned or controlled, that would be like a group home is provider-owned or controlled. There's a couple of other extra requirements. The unit or dwelling is a specific place that can be owned, rented, or occupied under a legally enforceable agreement. And it has the same responsibilities and protections from eviction that tenants have under the landlord-tenant law of the state, county, city, or other designated entity. So this is really to give individuals with disabilities the protection that if something happens and they've been having struggles with this particular setting and something happens where they end up at the police station. that home can't say, I'm sorry, this person isn't welcome. They have to have the same rights, just like you or I have, of eviction laws. Each individual has to have privacy in their sleeping and dwelling unit, which means they have the opportunity to decorate their room just like anyone else would, right? That they have a door that can be locked with only appropriate staff having the keys. That they have, a choice in roommates potentially. That individuals have the freedom and support to control their own schedules and activities, and that they have access to food all the time. I can go in the middle of the night and have a snack. Someone else should also be able to do that. There shouldn't be set times where they can only access food. And if they miss lunch, oh, sorry, we don't have anything until dinner. So people have to have access to food. Individuals are able to have visitors of their choosing at any time, and the setting is physically accessible. Now, there are exceptions to these requirements. So if an individual, for them to have access to food at all times, if they still need to work on food choices because they have diabetes and having access to all food at all times would negatively affect their health, and they still need to have some sort of limited access to that, that has to be very well documented in a person-centered plan, right? So this person-centered plan is this space where if any of these other requirements are putting that person or others at risk, they can be waived as long as it's fully documented in the person-centered plan. And these elements are part of those requirements that need to be in that person-centered plan. Again, all of this information is in that handout. Settings that are explicitly not eligible for HCBS funding cannot use HCBS funding. This is the only time in the final rule that they said this setting is not allowed. And those are nursing facilities, institution for mental diseases, an intermediate care facility, a hospital, or any other locations that have the qualities of an institutional setting. It's important to realize that these HCBS waivers are not just used for the population of those who have intellectual and developmental disabilities. This also applies to those who are elderly, and it also applies to those who have mental health challenges. And so they really don't want these type of waivers that are supposed to be waiving institutional care, right, so that people can access funding in their home and community. They don't want it to go to an institutional setting. There's funding streams that are very specific for institutional settings.
Is that the HUD secretary or secretary?
The HHS secretary, so Health and Human Services is Administration for Health and Human Services. CMS, Center for Medicaid and Medicare Services, is within the Department of Health and Human Services. Settings presumed not to be eligible. So these settings are presumed to have the qualities of an institution. A setting that is located in a building that is also publicly or privately operated facility that provides inpatient institutional treatment. A setting located on the building, on the grounds of, or immediately adjacent to a public institution, or any other setting that has the effect of isolating individuals receiving Medicaid HCBS from the broader community not receiving HCBS. So these are presumed not to be eligible, which means they would have to go through a series of heightened scrutiny, right? So they're not saying that these are not eligible. That was the previous slide. These are presumed not to be eligible because they typically have the qualities of an institution. So heightened scrutiny, this is the process by which we're going to determine those that are presumed institutional or that states aren't quite sure if they meet the HCBS guidelines. Those settings are going to have to go through a process of higher scrutiny. And this has been done in North Dakota for the Life Skills and Training Center. And this center was located on the grounds of an ICF. So it was on the grounds of a public institution. CMS contracted with an organization to conduct the review. So it wasn't CMS doing it. It was a third party that conducted the review. Information was given by the state as well as those who are involved with that training center. This training center also happens to be on the grounds of a public institution where their disability protection and advocacy agency is. And they determined that that setting does not have the qualities of an institution and that it does have the qualities of a home and community-based settings. And that's because that setting had access to the community and that those residents were integrated into the community. So even when a setting is presumed to be institutional, through the higher scrutiny process, it could actually come out that, you know what, it does meet the criteria for home and community-based settings. So just in general, for the HCBS final rule, there was nowhere in the final rule that it talked about setting size. Physical characteristics was not part of the federal rule. There were no person limits, there were no bed limits. It did not expressly rule out disability-specific settings. It did focus on the outcomes and experiences of persons with disabilities, which is why some of the criteria is having access to food, being able to decorate your room. Those are outcome-oriented examples. There is a 5-year implementation period, and these characteristics will also apply to non-residential settings as well. And now it's this point that's really important, is that these are the federal regulations. So this is the floor. This cannot be changed, right? This is the federal criteria. It was up to all of the states to be able to put together a transition plan. How are our state regulations and procedures going to change to meet the federal criteria, right? And so last year there was a period where states had to put out a draft of their state transition plan for public comment. It was a 30-day public comment. Several states decided to do several rounds of public comment because there was so much public comment, and they had to revise their transition plan based on that public comment. And that revision of the transition plan was due in March of this year. So they had 1 year to be able to get stakeholders' input and be able to submit a draft of a state transition plan to CMS. And CMS is currently in the process of going through those transition plans and deciding, yes, we approve this transition plan, and now states will have 4 more years to bring all of their HCBS settings up to compliance and procedures and policy. So by March 2019, everything will have met the standard, the federal standard. So it was a little bit confusing though, right? So we come out with these federal definitions, and we're talking about things that are presuming to be institutional, but what exactly does that mean? And how do you know if something isolates or segregates? And so CMS put out guidance then in March. And the CMS guidance is not the federal regulations, it is guidance. And they said that settings that have these 2 characteristics alone might, but not necessarily, meet the criteria for having the effect of isolating individuals. And those are settings that are designed specifically for people with disabilities and often for people with a specific type of disability, or settings in which individuals are primarily or exclusively people with disabilities and on-site staff provides many of the services to them. So CMS said these are typically what a setting would look like if it's isolating somebody. They also said that settings that isolate people receiving HCBS may have some of these characteristics. They might be designed to have multiple different services. So if they provide residential care, maybe they'll have a day program on site, or maybe they'll have some sort of other recreational and planned activities happening on site. People have limited interaction with their broader community, and that the settings use or authorize interventions and restrictions that are used in an institutional setting. Remember, the new regulations were really to be able to use these waiver dollars for home and community-based settings. They did not want it to go to settings that really should be using institutional monies. And they very specifically gave examples of these 4 different kinds: farmsteads or disability-specific farms, gated secure communities, residential schools, or multiple settings co-located and operational related. Now, continuing care retirement communities were excluded from this. So these type of communities for the aging population were excluded from this aspect of the regulations. And again, this was guidance. And so here we have, once again, the final rule was published in January, the transition clock started, all of the plans were due, and then by 2019, all of the transition plans should be complete and all settings must come into compliance. So the Coalition for Community Choice, we have organizations across the country. All of these organizations were looking at their state transition plans, the drafts, and saying, what do I do with this? We're supposed to give public comment. What does this mean? And so a lot of our leaders were working together to be able to determine, did the state transition plan, did it go beyond the federal requirements? What in our state transition plan was going beyond the federal requirements, and how should we be responding? And what we found while doing this process was that some states were reverting back to physical characteristics instead of having outcome-oriented criteria. And some states were telling advocates and providers that campus settings, farm settings, and intentional communities would not be funded by CMS. And that states were creating restrictive criteria that may automatically exclude settings from being evaluated or put through the higher scrutiny process. These were some of the main concerns of the Coalition for Community Choice. And so we got together and we wrote a letter, we sent it to CMS, and we received a letter back that basically said, states have the ability, they have the authority to create more restrictive regulations if they choose to do so. They said that those settings would not be automatically not funded by CMS, but that those type of settings needed to meet the final rule requirements, and that every existing setting would have to go through a higher scrutiny process. So some of the highlights and trends, some of the STPs were very short, 10 pages, and other ones were 500 pages. So they were very diverse in terms of what were in the STPs and how detailed did the states go. We learned that the state didn't do a very good job of giving advocates information in a very clear fashion, especially individuals with developmental disabilities. These state transition plans were not very easy to follow. There wasn't a good system for educating constituents in order for them to give hefty public comment. We found that we were having to do a lot of education during this process. Many states were using just provider self-assessment, so they were going to send the providers a checklist and say, do you meet, here, go ahead, and do you meet the criteria? And it was just going to be up to the provider, the honor system, to be able to check that off. And that's not very good for individuals with disabilities, in which the provider might be checking boxes off that yes, they are meeting criteria, while the individuals being served do not feel as if they're meeting that type of criteria. But it's also not good for the service provider if that assessment tool has criteria in it that is more than the final rule. So if it says, do you serve X amount of people? Where is your location? Then it wasn't good for the provider either. And so we found that there needed to be a good balance between provider self-assessments and the need for those who are receiving services to give feedback. And that even though the person-centered plan was integral to the final rule, that wasn't necessarily needed to be included in the state transition plan. So the states didn't even have to include a process for teaching and educating folks and families of how to put together a person-centered plan. There were some states, most states did not go beyond the federal regulations. Most states did not. There were some states that did. Ohio, they very specifically said that farmsteads would be excluded from HCBS funding, and there are several very prominent farmsteads that are in Ohio. Bittersweet is one of them. They were the first farmstead that was created specifically for people on the autism spectrum. And so they did a lot of advocacy with their legislatures, and they got 16 out of 18 members of Congress to take a look at the federal rules and then take a look at what their state wrote. And they wrote a joint letter to the Secretary of HHS saying, we're really concerned that you're talking about these farmsteads being isolating, because we've visited Safe Haven and we've visited Bittersweet, and they're not isolating and segregating at all. they're fantastic opportunities for people who desire that type of lifestyle. And so they ended up getting their state transition plan revised, and it didn't include that exclusion. Many, Massachusetts had a 5-bed rule, so that was inserted in, which had not been before, so they were going to have a 5-bed limitation, only for licensed group homes. And they created petitions, and they created a Facebook page and a blog to help educate stakeholders and share concerns. Florida, their state transition plan actually included their assessment tool, and in that assessment tool, it had a question that said, how, is your project this big? Is your project that big? So it was using physical characteristics as part of the assessment, and so those advocates said you need to remove line 1.1a out of your state transition plan. It's not following the intent of the final rule. Nevada actually submitted draft language to include what a definition of community could be. And it was included in their STP. And they also decided that they were going to actually survey those who are using HCBS waivers. And they ended up getting 800 surveys back. In Massachusetts, in their initial state transition plan, it named X amount of providers that were going to have to be closed by this date. And so Massachusetts, they created a work group for those providers to have the discussion about, listen, we are serving people in such a way that is benefiting them. They want to be here. We are not segregating and isolating people. How can we work together so that we can meet the HCBS criteria? And so they created that work group, and they weren't even put on the list of settings that were going to go through higher scrutiny. They said, yes, once you work with us, you'll be able to comply. And then many states requested to have the development of some sort of transition advisory team. So it wasn't just this state that was going to be monitoring what was happening through the rest of these 4 years, but they wanted stakeholders to be there at the table in all forms of the transition process throughout the next 4 years of transition. So, New Jersey State Plan. You all win the award for definitely having the most restrictive criteria that I saw across the country. There were many things that were in your state transition plan that went beyond the federal requirements. These 4 were the elements that really concerned individuals. So in the draft, right, in the draft of your state transition plan, there was a 75% mandated integration. So if somebody went to a facility-based day program, that they would have to be off-site 75% of the time. There was a 4 to 6 bed limitation, which means any group home or SLS would have to only have 4 beds, really, but you could potentially get approval for a 6-bed opportunity. And then there's a restriction of 25% of all total units for HCBS recipients. So if there was an apartment building, that only 25% of those units could be occupied by those who were receiving HCBS waivers. And then there was an exclusion of farmsteads, which was concerning to some folks who were interested in potentially creating some sort of farm-based program. Now this was the draft. Right? So there was a lot of advocates, I'm sure many in this room, that went to the public comment periods and said, we can't have these things. You're going to be limiting choices, not just for now, but also for the future. And so New Jersey made some revisions. They took out the 75% mandated integration rule, and instead they replaced it with this. Individuals in day programs spend the majority of their time engaging in integrated activities with the broader community of non-HCBS recipients inside or outside of the day facility. And that the certification of day programs will have to include the review of plans from the day providers to demonstrate how meaningful community engagement will be provided. So there was no longer that physical characteristic. Now it was more, it was the regulations, the policy gives a little bit more flexibility. The 4 to 6 bed limitation, it said that This was going to remain, so your state transition plan has this 4 to 6 bed limitation. Congregate housing settings will need to comply with the guidelines on group home size contained in the federal money follows the person demonstration program. And then you could potentially have a 6-bed opportunity. Now this is interesting because the money follows the person demonstration program really is specifically one pot of money that is helping people who live in an institutional setting be able to transition back into the community. So they've overlaid that reasoning for all settings, which is different and is not required by the federal regulations. And then also that the STP also clarifies that the provision applies to new settings only and will not be applied retroactively. So if somebody lives in an 8-person group home, that they will have to go through the process of making sure that that setting meets all of the other HCBS criteria, but that 4 of the individuals that live there or 2 of the individuals won't automatically have to move. So there are settings that have been grandfathered in. The restriction of the 25% of total units for HCBS recipients, that stands. Again, there are some settings that will be grandfathered in, but any new settings, this will apply to. And from what I understand, this could impact some opportunities, housing opportunities that were being created here in New Jersey that would have provided housing opportunities for HCBS recipients. And so this 25% very specifically comes from a Section 811 HUD rule. And that 25% is, again, for that very specific pot of money, and it seems as if the state is implementing that even beyond just licensed group homes and beyond just trying to use HUD funds, but really for any potential multifamily housing opportunity, that only 25% would be able to be HCBS recipients. Yep. And this is the wording from your state transition plan. Now this was a good insert. This does not apply where individuals own their own homes or where they live with a family member. So, yes.
What's interesting about Section 811 is that's not a big pot of money. There are very, very few people who are able to access that.
Yes, it's a very small amount of money, a very, very small amount of money, exactly. And then they revised the transition plan so that any new development, they didn't say there will not be any farmsteads that are funded. They said we'll have to consider a proposal to make sure that they comport with the HCBS final rule. So, your state made revisions to your state transition plan, which were positive, but there are still aspects of your state transition plan that is going beyond what the federal requirements are. And so, there are some next steps that you can make. The first would be to read the New Jersey state plan. Autism New Jersey did a really fantastic job of creating this report that shows what the draft plan issued, right? What was Autism New Jersey's recommendation, and then how the state revised that language, and then also, is there further action needed? Is there still space for more advocacy? So really, the first step is you have to read the state transition plan. It's not hundreds of pages long. I think it's under 50 pages. It's not terrible, but it's really important. And if you can't do that, if that's just absolutely mind-numbing, at least read this report that Autism New Jersey put together, because they really did a very, very good job. Another question that I have just openly for those of you who were part of that public comment period, do you feel as if the state did change and revise the regulations based on the proportion of people who are speaking? And if so, then that's positive. Let's continue with a positive relationship moving forward. But if not, you could consider telling CMS that your state did not adequately provide the information necessary and did not engage stakeholder feedback enough in the revision of their state plan. You can tell that to CMS and say, we really would have liked to have another 30-day public comment period now that we were able to know a little bit more about what this was about. In other states, they had multiple public comment periods. It wasn't just one public comment period. And so if you feel as if that may have happened, you could reach out to CMS and talk about how you feel as if New Jersey could benefit from having one more round of public comment before CMS decides to approve the state transition plan. Because up to my knowledge, CMS has not yet approved the transition plan that New Jersey has sent to them. DHS will seek input for an assessment tool when they're going to be assessing these settings. It is really important that you continue to be on the lookout for this opportunity. This is a fantastic opportunity for you to give feedback. You need to focus on the questions that might be based on physical characteristics and say this should not be included. We need to have more outcome-oriented questions on this. And even better if you can offer suggestions for questions that would help identify and document barriers of access. It is really important that we know what are the barriers of access to individuals to their community. An example of this might be, the question could say, how many times a month does Maria go out to dinner? Well, how many times a month does she want to go to dinner? And what prevents her from going out to dinner as often as one would like? I mean, the obvious answer is we don't have $5,000 a month to be able to go out for dinner, but I'm speaking in more terms of, does she not have transportation? Is there not support staff? Are there only certain days that we're allowed to go out for dinner and we can't go out other days? What are those barriers that are preventing access? See if your state has created some sort of transition advisory committee. And if they have, who is on that committee? Does it have HCBS recipients who reside in a variety of different settings? Are there parents that are on that committee? Are there service providers adequate? Is it a variety of different types of service providers? Are there direct support professionals on that committee? And are the affordable housing developers in the room? We need more affordable housing. And if none exists, of course, request to create one. Build relationships with your legislatures. This is really important that your legislatures know who you are, that they know your story, that individuals with disabilities are taught to be advocates, that they start to learn how to speak for themselves. It is really, really important that your legislatures are aware of some of the statistics that were in the beginning of this slideshow. Do you realize that we have this type of support service crisis on our hands? Do you realize we don't have affordable housing? That there's a whole gap of individuals who will not be able to live with their primary caregiver because their primary caregiver is going to need support as well. We need to fix this urgently. What are you doing to fix this? Please contact your legislatures. It's really important and can be very, very helpful in the future. Start the person-centered planning process. Look at the final rule requirements for this. You can go to hcbsadvocacy.org. It has all the lists to hundreds and hundreds of pages worth of information. But we need to be able to start documenting what are the needs of individuals, what are their desires. To start this now, even if it's just trying to think about, hey John, who is part of your life that needs to be around the table? Who is going to be part of this plan moving forward? And really thinking about moving forward without the parent in the future. It's going to be really important that you start doing that, especially because that documentation has authority behind it. One of the other things that I did want to share with you is that all across the country, it's not just New Jersey that's struggling with this. Across the country, all of the states are struggling with this. There's not enough housing, there's not enough waivers. That's just the reality. And so a lot of nonprofits, families, providers are coming together really to co-create the future that they want to see. We know what the past was. We never want to go there again. The present has very serious challenges. So how are we going to make the future even better? And so the next couple of slides are really just showing different opportunities in different states, not in New Jersey, that were created originally just around a kitchen table by parents. They used public funding to create these opportunities. And I just wanted to show you what could happen if there weren't such restrictive regulations that were put in place in New Jersey. So this is Sweetwater Spectrum. They've gotten a lot of press. Many of you have probably heard about them. It's 16 units, very specifically designed for those on the spectrum. They use the Advancing Full Spectrum Housing report as a guide that came out of SARC and University of Arizona. It is designed very intentionally to meet the needs of those on the spectrum. The Sweetwater Spectrum does not provide any supports. Every individual that lives at Sweetwater, they coordinate with whatever service provider that they would like to have to be supported. But it is just individuals with autism that live there. They have a common pool area. They have a common meeting room. It's basically four big units that have 4 rooms each with common kitchen and common dining area. It's really beautiful, located in Sonoma, California. The next one is the Faison Residence in Richmond, Virginia. This grew out of a school. So there was a school that was created for those on the spectrum, and they realized that when their students were aging out, there wasn't a whole lot out there. So they created this apartment building, and one of the floors of the apartment building is primarily for people with disabilities. And it is equipped with technology in order to help decrease the dependence on in-person staffing and increase the opportunities to be able to share the private funding potentially and the public funding across many of the different units. And so they use this technology that is kind of like help on demand. And so when an individual opens up a refrigerator and a gallon of milk drops on the floor, the individual can call for help, and a video camera will pop out of the living room and say, how can I help you? And the person that's on the other end knows this individual, knows what that specific individual needs in terms of steps to be able to solve a problem, and they try to verbally walk that individual through creating the solution. And not only does that boost the individual's confidence, right, and teaches them over time how to handle these type of crises, but it also gives that person the privacy of not having to have an in-person support in their home with them all the time. They use a lot of other smart home technology as well. They use seizure pads for those who have seizures. They have smart home technology where if somebody's cooking and then they walk away and they forgot the burner was on, if there isn't movement in front of the burner, after a certain amount of time, the burner will automatically shut off. And then there's also people who are looking after all of the different common spaces. So the cameras are not in a person's private spaces. It is only in the public spaces. But if the person who's watching realizes that an individual has been in the bathroom for an hour and a half, they can virtually knock, which you can see in the bottom hand corner, and they can say, are you okay? Are you okay? Are you okay? And then if there's no response after a certain amount of time, then somebody can be deployed. And this also, over time, will decrease the costs of in-person staffing as well. Eric's Retreat. This is in Minneapolis, Minnesota. If you ever go to Minneapolis, Minnesota, you need to stay at Eric's Retreat because it's a bed and breakfast. So one floor of the bed and breakfast is the residences for the individuals with disabilities who work there, who work as in the hospitality realm. And then the other rooms are being renovated in order to supply accommodations. Right now, they only have one floor that is ready for guests. I was very lucky to have been able to stay there when I was in Minneapolis. The accommodations are beautiful, and I was also able to visit some of the residents' rooms, and they look just as beautiful. Additionally, they have a very interesting opportunity. So not just do residents who live there get to work in the realms of hospitality. I had someone come and take my breakfast order. They brought me breakfast. They showed me to my room. But they also have the opportunity to give tours. And so tours have been created based on an individual's interest. So if they're really, really interested in airplanes, one of their residents has the opportunity to create these custom tours and talk for half a day all about airplanes. It is their passion. It's what they like to do. They're getting paid to tell people about their passion. And people have the opportunity to have an interaction with someone on the spectrum so that they learn how to be a support person, maybe to someone on the spectrum in another type of setting. Maybe they're at a restaurant, maybe it's their neighbor's house. But it helps provide employment for an individual with a disability, but it also provides the opportunity to have that integration. Neurodiverse co-housing. They have communities in planning in Florida and Washington, and I just came from one that is in North Carolina. This is the North Street neighborhood, and it has. Where am I on time? Okay, it has a cool enough story that I need to tell you. And so there was a group of families who wanted to be able to live closer to each other. So they started looking for houses that were maybe on the same street. This way they can provide just those natural supports. And one of the family members came across this lot that had these big buildings on it that were just in complete disarray, but there was 17 of them over the course of like 3 lots. And so he called his developer friend and said, hey, do you know about this property? He said, yeah, I just bought it in a short sale. I'm building a high-rise across the street, and I want to make sure whatever goes in there is going to be appealing for those who are going to live in the high-rise, right? And he said, why? And so they told them the story about how they want to be able to create a neighborhood where people with and without disabilities can live together and just support each other. And he said, great, I'll do it at cost. And so 16 out of the 17 have been bought. This is what they look like now. They were completely gutted. And what was really interesting is that they're gutted and they're redone in order to accommodate what the buyer wanted. So I'll give you an example. One of the houses was bought by a family. In 3/4 of the home, the husband, the wife, and their 4 kids live. Their 4 neurotypical kids. And then in another quarter of the home, they created an apartment for their older son who wanted to live on his own. So in the same house, they have their 2 separate homes. And once that family decides to move on, the person with the disability who lives in that quarter of the property can either rent out the rest of the house and therefore provide income for himself by renting out part of that house, or he could move into that part of the house with some of his buddies, and then he could rent out the quarter of the house for somebody. And all of the houses were different. 2 of the houses had apartments, apartments on the top, and then there was someone living on the bottom. One of the buyers decided that they were just going to live on the top, and they were going to turn the complete bottom of the house into like a community center where they can have meals together or host game nights and stuff like that. Just did it out of their own heart. They have a lot of calm shared spaces, so there's 3 rules to be able to live in North Street neighborhood. 1, there can be no fences. No fences around any of the houses, and all of the backyards are common space. So there's a basketball, there's a community garden. People can walk from house to house through the backyard and never have to cross the street. And then the person who lives in the house, whoever buys the house, either has to provide housing for someone with a disability in their family unit, or has to be willing to create another part of that unit for someone with a disability, and they have to be willing to provide those natural supports. So if you're going to buy into the neighborhood, you're buying into the whole desire of wanting to live in a neurodiverse community. So this is what it kind of looks like. It's just 17 houses that were redone, and every house has at least one person with a disability that lives in some part of the house in some shape or form. 2 of the houses are managed by the ARC as like a group home, but they provide shared living accommodations for the local divinity students who go to the seminary, Duke Divinity School. And so they have roommates who are going to divinity school, but it's their house first, which I feel strongly about. Did I miss one? No. Okay. So the Art Village, this is being built in Jacksonville, Florida. This project is going to be providing 68 one-bedroom apartments and 29 two-bedroom apartments. The rent is going to range from $200 a month to $700 a month for the two-bedroom, and that would be split. They have some of the units where you can use a housing voucher, but the other units were created in order for someone living on just SSI to have enough money to pay for rent, be able to pay for their utilities, and still have money left over to do things in the community. What's really interesting about them is the way that they were able to partner with local community members. So in Florida, we have a very long wait list, just like New Jersey has, where it's very hard to access support services. So they created this realizing that not everyone would be able to get a waiver. And so they have created opportunities through partnering with AmeriCorps, through the different colleges. They have an RN that's going to be on site for medical needs. They're creating an employment center. So there's a community building where a resident will be able to go and get help, get assistance being able to find a job in the community. This is located right in the middle of the suburbs of Jacksonville. In this bottom right-hand corner, left-hand corner here, is potentially going to be a YMCA. So individuals who live at the Arc Village could use the Y for free or get a job at the Y as well. And so this is being paid for partly by low-income housing tax credits. So in Florida, they've actually garnered 5% of all low-income housing tax credits. And low-income housing tax credits are basically a pool of money that every states get in order to provide affordable housing. And so they have 5% of that money gets to go to the development of these types of communities for people with intellectual and developmental disabilities. And this is just one of 4 that has been funded. $50 million has gone into creating affordable housing in these types of communities for individuals with developmental disabilities. And then one of the criteria is that 80% of the units have to be given to somebody with an intellectual or developmental disability. So none of us can do this alone. This is a national crisis. It's not just about New Jersey. We have almost 1 million people who are living with a caregiver over the age of 60 across the country, and less than 250,000 out-of-home opportunities have been developed in the last 20 years. But working together, I do believe solutions are possible. All of those communities that I showed you, those are very specifically communities that would not be possible here in New Jersey because of your regulations, but there's lots of different type of housing solutions that states are coming up with. Using accessory dwelling apartments to do the same thing that co-housing community did, where families can build an accessory dwelling, somebody with a disability could live there, and then possibly provide an income stream in the future. Being able to use a group adult foster care funds, but first housing where the individual with the disability is the one who's in control of their housing, not necessarily inviting people to go into neurotypicals' houses. There's lots of different ways that we can try to create more housing solutions, and Madison House Autism Foundation is very much committed to how can we create innovative solutions for the future. If you would like to get in touch with me, this is my email. I invite you to go to the Madison House Autism Foundation website. You can also go to the Coalition for Community Choice website, where you can find online versions of the policy brief and FAQ that are in those packets. Please like us on Facebook. I'm constantly adding content to our social media feed to be able to share what's happening around the country. And we can't do it without supporters. So please join the coalition, check out Madison House, and I am up for questions as long as you all want to stay. Please, if you need to leave, that's fine. If you haven't signed in yet, please sign in, but I'm happy to try to answer questions or at least point you in the direction of who might have a better answer. So thank you. Thank you.